let your guard down. I'm not gonna let you fall. Hold on to me now.
Hello, everybody. Welcome. Literally right off the bat, I'm dealing with technical difficulties. It's fine. No worries, guys. Guys, thank you so much for joining. Let's make sure the music actually works here. Alexa, play my music on Spotify. Why is it playing in my ears? I'm so sorry, guys. Of course, this is literally happening right now. There we go. Now we're going to get it, guys. Sorry about that. It's okay. We're only 1 minute in. Wow. There it is. Oh, boy. Hello, everybody. Hello. If you don't know me, my name is Gabby. Hello. This is a show called In It Together with Gabby and Sammy. We do every single Tuesday at 9 p.m. Eastern Standard Time. In this show, we talk about coping with emotional, social, and psychological well-being to promote self-healing and self-development. Every week, we have a new topic that has to do with mental health. We have a new topic every week where we provide you guys with education, resources, and tips so you can apply to your everyday life on your journey to fulfilling a happier life. So I'm really glad to see you guys here. I'll just wait maybe a couple minutes to get some people in here. Raina, I don't know if you're here already. My guest is off of the app today. She's somebody who I know in person. We actually went to college together, so I'm really excited to have her on. Sean, thank you. Sorry, guys, go figure right off the bat. I literally had technical difficulties from the beginning. Raina, welcome. Thank you so much for being here, Raina. I really appreciate you. Can I get a 1? Let's see who's here. Hit a 1, everybody, if you're here. And if I see you at the end of the show, I appreciate you. Sean is here. Cody is here. Cameron is here. Big Brom is here. Sammy J, of course, is here, my co-host. Paulo, I see you. Ju, 29. Kelly. Oh, hi, Kelly. Good to see you here today. I'm so excited. Hello, Eddie. Guys, welcome to the stream. Welcome to the show. I'm so excited to have you guys here today. I have a really cool episode in store. But before I give too much away, I have an intro for you. We always start off the show with an intro that actually was made by me and Ash Marie. Let me turn my GIF sounds off so I don't get totally bogged down with sounds. Thank you guys for the gifts. Thank you for the comments. I appreciate you guys for being here. My day was a little unusual and a lot of crazy things happened today. So bear with me here, guys. And thank you so much for being here.
Invincible. If you let your guard down, I'm not gonna let you fall. Hold on to me now. I'm not invincible. Drowning in self-doubt. Can you pull my demons out?
Over, guys. I'm not invincible. Thank you guys so much for being here tonight. If you guys don't know me, my name is Gabby. This is a show called In It Together with Gabby and Sammy. Sammy is in the chat. She is my co-host. She'll be joining us shortly. And I'm so excited for the show today. I'm so excited just for this day period. It was a beautiful, beautiful day in Ohio today. I hope you guys got the opportunity to enjoy the weather if you had good weather where you're at. What are we in? We're in it together, Tyler. So on this show, we talk about coping with emotional, social, and psychological well-being to promote self-healing and self-development. Every week, we bring you a new topic where we provide you with education, resources, and tips that you can apply to your everyday life. And today is actually our fourth episode in a series we're calling Holistic Approaches to Healing the Mind. So if you haven't been here, which by the way, last week we actually had the week off because I went on vacation. So I am really glad to be back. It feels like we've been gone forever. So thank you guys for coming back. If you've been here for the past 3 episodes, we've covered yoga, nutrition. Wow, here I am losing my mind. Yoga, nutrition, and massage therapy. If you were here for all 3 of those episodes, can I see some ones in the chat? I know at least some of you guys. Sammy was here for every episode. Sammy, thank you so much for being such a proactive viewer. Yo, you guys are amazing. I see you. Chelsea, Paulo, Ash, Missy, Cody, Andrew. Thank you guys so much for continuing to come in here and get educated with us. So if you were here 2 weeks ago, because we had last week off, we covered nutrition with a holistic sports nutritionist named Jamie. And we learned a lot during that episode. So I hope that if you guys haven't seen it, you will go up to my YouTube channel in my bio. It's just a button. You'll be able to see every episode we've ever done, except for one, unfortunately. But today we are going to be talking about the benefits of physical therapy. So if you guys have ever been in physical therapy, can you hit a 1 in the chat? I have been to physical therapy, actually like 4 times. So thank you guys. If you guys are definitely going to relate to this, if you haven't been to physical therapy, that's okay, because you're going to learn a lot of new stuff with us, and we have a lot of really cool stuff to cover today, guys. So just to give you an idea of what to expect on the show, we begin every show with an Instagram Q&A segment. So on my Instagram, which is in my bio again, we always have topic questions, usually around the weekend. And it's a really cool way to give you guys some personal content. You guys are the ones answering the questions, so it's always really fun for us to read them. And then we share them anonymously here on the wall. So it gives us a really good way to start the conversation off. After we do the Q&A from Instagram, Sammy's going to join us in the box. We're going to discuss it a little bit, and then we're going to start talking about what physical therapy is, and what it means to have physical therapy in the mental health field. So it's pretty cool. Of course, we'll have our stats and facts section, which is Sammy's favorite. And then we're going to just review a little bit about exercise and its benefits on our mental health, which we have covered in the past. So if you guys haven't seen it, you're going to get a good little review today. And then after we cover some of those review from the exercise episode, my very good friend Raina, who is a physical therapy assistant, and I am also a physical therapy assistant, so this is like really cool for me to be able to do an episode like this. Raina is going to come into the box. I'm going to talk to her a little bit about why she decided to take the route she did in her career. I'm also going to ask her some of her experiences that she's had as a patient as well as a PTA. And then, of course, we'll have a Q&A segment with her if you guys have any questions. So, guys, thank you so much for being here. Let's get started with the Q&A. So the first question I had for you, actually, let's start with this. I put it in the wrong order. The first question was a poll. I always have a poll question. Have you ever had physical therapy? I saw a lot of you guys in the chat say, yes, you have. 64% of you on my Instagram said, yes, I have had physical therapy. So a little bit over half, which is, I don't really know if there's a statistic for it. Me and Sammy didn't really look into that, to be honest with you, but it's interesting to see how many of you guys have had experiences like this. The next question is a 2-parter. Why were you in physical therapy, and how did physical therapy impact your emotional and mental health? And thank you guys to everyone who took part in this, especially because it is anonymous, but obviously I see who answered. So I appreciate you guys for being vulnerable enough to partake in this part of the show. So why were you in physical therapy? It's a 2-parter. So everyone answered 2 parts. So car accident injuries. This person was in for car accident injuries. And how did it help them emotionally and mentally? A physical therapist always made sure to be super encouraging during difficult times. This person was in PT for a neck injury. PT being physical therapy. You'll probably hear me abbreviate it quite a lot. It helped me tremendously by coping with the physical aspect of it. I was able to control the emotional aspect of it. This next person was in physical therapy because of a sports injury. And they said that when they first got injured, they were really mad about it. But once they were actually in physical therapy, it helped them to kind of calm down and it made them feel like they had a purpose. This individual was in to improve their flexibility and strength. You might even talk to them today. I don't know. They might comment on it. Physical therapy helped them to feel more confident and to feel more self-productive. Wink, wink, right in the chat. Might be Sammy J. I don't know. This person had physical therapy for their hip when they were a kid, and it helped them, which is awesome. And physical therapy helped them to have a clear mind and to feel happy. This person was in physical therapy due to a Achilles tendonitis 3 times, which is really a bummer. So I'm sorry you went through that. But PT was positive for them. They were able to have something to focus on. They had goals to accomplish. This was a 2-part to their answer. It also gave them the ability to explore different avenues of fitness, like cycling and swimming, which is really cool. This person was in PT for a dislocated kneecap. This is not me. I didn't answer the question, by the way. You guys know I suffer from this, but it wasn't me that answered. And of course, they said PT helped them to have a stronger mindset. This individual was in for a knee injury and a back injury. And being in PT enlightening knowledge of your body. Really cool. So that's all of the 2-parters. Some of you guys answered the first part, not the second. So just to kind of go through them, people who were in PT had shoulder injuries, knee injuries, hip injuries. Someone had an MCL sprain and a meniscus tear, which is a bummer. Someone busted their hand and had to rebuild their strength. So those people didn't answer the second half of the question, but they answered the first part. So thank you guys for participating in that part of the show. If you guys are just joining, this is In It Together with Gabby and Sammy. Today we're talking about the benefits of physical therapy on our mental health, and Sammy is finally joining us in the box. Hello.
Hello.
Wow, do you just love how my these don't even work? I guess we're just gonna go without the headphones today, guys.
No,
Wow. It's fine. It's
it feels
fine.
like deja vu from Sunday. My headphones didn't work then.
Sammy, how are you doing today?
I'm good. I missed you guys. I'm so glad.
I know, it feels like we haven't been here forever.
I know. Week off feels like an eternity.
Oh, absolutely. So how did you feel about some of those responses? This might be your first time seeing them because I just made the PowerPoint today.
Yes. No, I think that's great. You guys always surprise me with your insight. So the more insight we have about ourselves and what helps and what doesn't help, and all that is great. So great to see that some people had some really great experiences with PT. I'm glad we didn't see any negatives in there. So sounds like everybody had positive experiences.
Yeah, because honestly, physical therapy can be kind of a drag. Sometimes there's a lot of pain involved, especially if you've had like post-op, like if you're post-surgery and stuff like that. So PT stands for pain and torture, as some of my patients have said. If you guys are just joining, I'm actually a licensed physical therapy assistant, so I'm really excited to do this show today because I relate. And our guest today, stay tuned, her name is Raina. She actually went to college with me, and she's a physical therapy assistant as well. So she's going to talk to us a little bit about physical therapy and her experiences. So
I'm so excited to meet her. This is the first time I'm meeting her too, guys. So
yeah, we had an unusual because of the holiday, we had an unusual week.
Yeah. It's been an interesting week.
So Sammy, have you ever had physical therapy?
I have. So Gabby was correct. That was one of my answers up there. So actually I've had physical therapy twice in my life. So as you guys know, I'm in a wheelchair. So when I was little, I used to have like a physical therapist come out to my school when I was in elementary school, and I was a little bit more had a little bit more strength and was a little bit more mobile, and they would try to do like easy exercises with me to keep some of my strength and mobility. Eventually we stopped with that because that just got to be too much for me to do school all day and try to do that. It just kind of zapped my energy, so it wasn't really probably one of our best ideas, but it helped for a short amount of time. And then more recently, I've talked in my stream some about my journey with getting my Spinraza injection, which helps with my SMA. So once I had started that, it was recommended that now that this medicine that helps build muscle, maybe you should do some physical therapy because now you actually could potentially build some strength. So I did do that for a little bit. And that was a really good, it was virtual, so it was probably very different than what traditional physical therapy looks like. And I think it was still very beneficial. So if anybody is thinking, with COVID right now, like, hey, I'm not sure that I want somebody's like hands all over me, like explore virtual options for that because they exist right now. And I think it was better than doing nothing. So
Absolutely.
lots of great ideas.
And a lot of you guys know this kind of go into my story. So I have a kneecap that dislocates a lot. I've actually had 3 surgeries. So I have been in physical therapy quite a few times, probably like 4 or 5 different bouts of physical therapy. Yeah, some pre-op, some post-op. And honestly, I've had an emotional roller coaster with it because I feel like when you go into therapy, you're kind of at your worst.
Yes.
So you're really not thinking super positive, but as you see the progress happen and you see that you're able to do more and more, it's just amazing to see what your body can really do. And having a physical therapist or an assistant there, like being your cheerleader, helping you progress is seriously amazing. I mean, the PT being there and the PTA being there for you is huge, especially for the mental health aspect of it, in my opinion.
Yeah, and I think what you're saying too about progress, like, and I don't know if this is true of all PT, so maybe you can answer this. Like, I know for me, they do a lot of like tests and measurements, and then we compare kind of as we're going, where was I and where am I now? And that really like, because sometimes you think to yourself, well, like maybe things are getting better, or like, nah, I still kind of feel the same. And then they do one of those tests, and they're like, oh, you're improving here, and you're like, oh wow, okay, like let me keep going with this. So that's really helpful.
I feel like once you get to a point, it is hard to tell how much you are improving until you see those tests.
Yeah.
So that kind of goes into a little bit of like, what is physical therapy? If you've never had physical therapy, hit a 2. I'm just curious who might be learning something really, really new today. Anybody not ever been in PT? Paulo's never been there. Ash has never been there. Cody's never been to PT. Well, you guys, good for you, actually.
Right.
If
you the champs here.
If you've been to physical therapy, you've probably been injured or something like that. You've probably become it's good for you guys. But once again, if you're just joining, this is In It Together with Gabby and Sammy. We do the show on Tuesdays at 9 p.m. Eastern Standard Time, where we talk about coping with emotional, social, and psychological well-being to promote self-healing and self-development. And we are talking about physical therapy today. This is our 4th episode of the Holistic Approaches to Healing the Mind series. And let's kind of, if you guys don't know what physical therapy is, let me give you probably
more. I get to sit back and relax a little bit. Gabby's going to educate you guys.
More of a textbook definition of it. So I'm a physical therapy assistant, and obviously there's a physical therapist who kind of runs the show, and I just kind of implement the show. But what we try to do here is to maintain, restore, and improve your functional mobility. We try to decrease your pain. And if you're in physical therapy, there's a chance that maybe you've lost a little bit of your independence. Maybe not completely, but you have probably lost a little bit of your independence. You're there to reach a goal. So maybe you're trying to go back to work. Maybe you're trying to get back to sport. Maybe you've been in a car accident. There's so many things that could cause you to come and see people like us. So to reach those goals, we prescribe you therapeutic exercises. We use modalities. And if you don't know what a modality is, massage therapy is actually considered a modality. We just had a show on it. We use a lot of different things. Just to name a couple, we use electrical stimulation, which sounds terrifying if you've never had it. But if you've ever gone to it does sound terrifying.
I don't want to be electrocuted.
But it just depends on the kind of electrical stimulation you have. It could be rough. But they have a kind that's more like a massage to help relieve pain. And there's also a kind that they use to help activate the muscles. So if you're having for example, for me, I would have a hard time activating my quad muscle here. So they would put that stem on you and it kind of activates it for you. And it's very not super like great to have happen. I'm not gonna lie, but
Not a fun
cool.
time.
It is really really cool. We use things like moist heat, ultrasound is something that can be used. A lot of cool modalities that we've learned in school. Which, by the way, guys, I am a physical therapy assistant, but I've been injured for the past like 3 years, so I haven't had a lot of experience in the field, and that's why I have Raina here today to talk with us more because she has a lot of experience. Of course, we do something called neuromuscular reeducation. So if you've had any nerve damage, we try to get those nerves to activate and fire properly. Maybe they're not even firing at all. Um, we do gait training, which is kind of like walking. So maybe there are people who have had things happen where they can't walk anymore. And our job is to get them back. So we literally can help people walk again, which is just absolutely, absolutely phenomenal. It's wow. I just get blown away with what you can do in physical therapy. And of course, we provide education to the patients. And if the patient needs caregivers, we provide them education as well. So Sammy mentioned that she had physical therapy in her school when she was, I guess, really, really
Elementary school, probably
elementary
like
school.
first, second grade.
So we work in a lot of places, schools. We work obviously in hospitals, nursing homes, outpatient clinics are kind of where you typically see us. There's even like aquatic therapy, which I think is super cool. We literally exercise you in a pool, which is so cool.
Yeah, and actually, I think I was telling you too about my friend who you were talking about gait training and now the water. So I have a friend who's on the same medication as I am that has been wheelchair bound for I think 5-ish years. And with physical therapy and this medication, he is now getting to the point where he can stand in water below his knee, which is
That's amazing.
really cool.
That's amazing. And what's cool about that too is if maybe you don't have a lot of strength to do like something just like getting up out of a chair, it's almost like you don't weigh as much when you're in the water. So it takes a lot of pressure off of your joints and stuff like that. And it gives you the opportunity to use those muscles that you couldn't really use when you're just on the ground, like
Yeah.
like level ground.
Gravity sucks.
Let's see here.
But yeah, so unfortunately, it sounds like from what we've talked about and what we've kind of researched, that physical therapy and physical therapy assistant programs don't focus too much on mental health. Would that be correct?
That is correct. Of course, we do take classes in psychology. We take a psychology class. I can't speak on the physical therapy programs because I am not a physical therapist. But I do know that we were able to take a psych class. We took a pathophysiology class, which sounds scary. And by the way, it was a scary class. It was very intense. But it was in that class we learned about a lot of different diagnoses that people can have, including specific mental health disorders. But we didn't get super deep, I would say. I would say, and again, I haven't been working as really much at all the past few years because of my knee injury, but Raina can speak on this. I would argue that in order for us to have experience in the mental health field, we would obviously need to have the experience or go out and get the education for it. And when we talk about physical therapy in mental health, it's definitely a specialized thing. So people who specialize in mental health, who are physical therapists and assistants, take classes. Or maybe you just got lucky and you worked in a facility where they had mental health patients in it. So yeah, you have to specialize in things like that. So it's pretty cool. So as a PTA, if I were to be working in a mental health facility, working with patients in this category, you would take physical approaches and psychological approaches. So not only would you do the exercise aspect that I've told you guys about, but you would also do like relaxation methods, mindfulness, body awareness, things like that. And of course, this can help if you're not only are you injured, but you're maybe in a facility because of a mental health thing that you're coping with, using physical therapy in addition can actually help to motivate you even more to gain independence or to improve your self-management, your overall well-being. And yeah, so that pretty much covers physical therapy in a nutshell and maybe a little bit of what it would be like to specialize in it. Now it's time for our stats and facts section. And if
Yay!
you get it together with Gabby and Sammy, it's a show we do every single Tuesday at 9 p.m. Eastern Standard Time. I'm Gabby. That's Sammy. I'm a physical therapy assistant, and she's a mental health mental health counselor.
Boop.
Gosh, wow, brain dead.
There's your brain fart for the episode, guys.
I can't afford to have any more. But yeah, guys, we're talking about physical therapy today and how it can impact your mental health. So let's get ready for our stats and facts section, Sammy J.
Yay. And guys, in the comments, we are not ignoring you. Save questions to the end. We are definitely going to answer questions. Hold on to them, because if we stop and answer questions now, we're never going to get done in time.
Pen and paper, guys. We're also going to have a Q&A with the physical therapy assistant if you have any questions about that.
Yep. So, okay, stats and facts. Let's go. My favorite part. So we got a few for you guys. We don't have probably as many as we normally do, but we do have some stuff for you guys. So some stuff we've already kind of reviewed before, but we felt like it was a good idea to bring it back up to you guys again. So a quarter of our population is coping with a mental health disorder, 25% of people. So there's almost 300 people in here. I don't know what the math is for that in 1 in 4, but 1 in 4 of you has a mental health disorder.
We're not here to do math.
I don't do math. I tell my clients that all the time. I make them tell me when our session is going to end because I don't math. Also nearly half of our population will experience, part of our population is coping with a mental health disorder. Half of our population will experience a mental health disorder at some point in their life. So a quarter are currently dealing with it. Half will have it at some point in their life. Depression is kind of the most common thing we see. It's very common, leading cause of disability in the entire world. So major depressive disorder and several other mental health disorders you can actually apply for like SSI disability for. Sometimes that's really hard to get, but there are people that have been diagnosed with these disorders that they say you literally can't work because it is so severe. So that's kind of a huge thing too.
Yeah.
And I think people look past that a lot about how debilitating it really can be to people. And that's not always just people that are untreated. You know, I work with several clients who have been granted that privilege of getting SSDI, and they're seeking treatment. They're taking their medication regularly, but it's a very severe disorder for them. So those of us who have a mental illness are prone to having poor physical health. And I think that comes with, you know, a lot of our disorders, our mental health disorders, have to do with like lack of energy, lack of motivation, that kind of stuff. So that can lead to bad physical health. We talked about nutrition. Nutrition can affect our physical health, all these things that happen, you know, that are kind of hand in hand. We're not really sure what comes first, but they happen hand in hand with each other. Those of us who are dealing with mental health disorders are prone to things like heart disease, diabetes, hypertension, different respiratory diseases. Again, we kind of reviewed this in some of our past episodes, but always good to know that these things are kind of linked because we want to do things to prevent these disorders. And again, this is due to being more sedentary. You know, sedentary is not being very active. Poor diet. A lot of people are self-medicating with things like cigarettes or different substances that are just making their conditions worse when they feel like they're making them better. So yeah. A quarter of those who suffer with chronic musculoskeletal disorder, so they're defining chronic as having this disorder for 6 or more months, have at least one mental health disorder. So Gabby, what would it be, can you think of off the top of your head what would be examples of like musculoskeletal disorders? I know I'm putting you on the spot.
I'm an example. If you guys have been here before, I actually have a knee that dislocates due to some malalignment to do with my bones and musculature. So that's a musculoskeletal disorder. So if you've ever had a rotator cuff tear or something, you know, things along that line, that's a musculoskeletal disorder.
So these are probably pretty common disorders, I would say.
Yeah, so that's more of your orthopedic type of stuff.
Okay. So probably a lot of people that are doing like physical labor work are experiencing these kinds of things. And then like we said, like accidents and that kind of stuff, probably experiencing these kinds of disorders. So think of how many people you know that maybe has those kinds of things, and they probably have at least one mental health disorder related.
And then think of how many of those people aren't actually proactive about taking care of the musculoskeletal disorder they have. I know there are people who, in my life, who say, "Oh, I pulled a muscle here, and now it's hard for me to lift my arm up, but it's okay."
My dad, every single day. My dad.
Think of the people who aren't even taking advantage of physical therapy and their doctors, and what kind of mental health disorders they might have. There's a lot of you guys out there. I know somebody out there has something wrong and they're not going to physical therapy for it.
Yes, yes. And NYC, those are more neuromuscular disorders than they are musculoskeletal, I believe, because I suffer from a neuromuscular disorder, and I know those are all in the same class. So it's a little different. But yes, so this is a lot of people that are probably affected by mental health disorders as well. Aside from the typical mental health treatment, meds and talk therapy, that's what we mean by typical. There's a lot of evidence that proves that physical therapy as a complementary treatment, so we're still going to do meds and we're going to do talk therapy, but we're also going to incorporate physical therapy, can improve mental health and physical health of patients with severe mental health disorders. So I know I target that a lot when I have clients that have physical pain, is like, well, obviously you're depressed or you're anxious, you're in pain all the time. Like, let's work on that too. Let's see if we can help your pain any. So yeah, it's good to look at a person as a whole and find out what is going on, and not just focus on, put the blinders on and say, well, let's just focus on the mental health disorder.
It's cool to think about it. So if you're in physical therapy, adding a mental health aspect to your physical therapy for whatever it is you're trying to achieve could really benefit you and help you achieve those goals. And then thinking about it from an aspect, if you're in therapy for, give myself an example, I have PTSD and bipolar disorder, so I do go to therapy on a regular basis. If they maybe add a physical therapy aspect to my regular mental health therapy, it could be extremely beneficial, and maybe even I could even surpass what we were expecting as far as like my goals go. So it's pretty cool. It's pretty cool.
Definitely. Okay, so as far as like specific studies go, there's your stutter for the night. We got the brain fart and the stutter. They did a study in the Netherlands that showed the importance of psychological healing as part of physical therapy treatment. So they talked about 30 to 50% of patients attending physical therapy for an injury were found to have other physical issues too that were not caused by the physical injury, but by other underlying issues like stress.
Who's stressed? Hit a 1.
Yes, who's stressed? I'm stressed.
Out a lot.
One.
I am.
Yes. If you're not hitting a 1, you're lying.
I think we're all probably a little stressed.
We all have stress. So they were saying they were finding more problems than just what people were coming for to physical therapy by exploring these other aspects. So these underlying issues can impact the treatment, especially if a psychological component is not worked on. So if our stress is causing physical problems and we don't target our stress, we're just going to keep having more physical problems. So it's important sometimes to target both, depending on the person and the situation.
Absolutely. So in this study, it was mentioned that professionals in the Netherlands actually created a whole new field called psychomatic physical therapy. And psychomatic physical therapy focuses on how a cycle of negative thoughts can impact your physical well-being.
Yes. So who remembers when we talked about anxiety, or we talked about mindfulness? Who was here for anxiety and the mindfulness episode? I think we had Zen for anxiety. Who did we have for mindfulness? Tyler.
We had Tyler.
Tyler and Zen were our guests for those shows.
Massage therapist.
Yes.
Chelsea, you're lying, but I really appreciate the effort. She didn't even join the app yet. I appreciate you. They're on YouTube, so maybe she watched it on YouTube. Oh my gosh, good job, Chelsea.
Oh, the anxiety one's the one that's not though. So we
Yeah,
did.
unfortunately that one didn't get recorded, but it was a great episode.
Ben did such a good job on that episode. So yeah, so what we're talking about here is cognitive disorders. So cognitive being thoughts, right? So we talked about those like cognitive distortions in the past, right? So one of them was disqualifying the positive, right? I'm only going to focus on the negative things that happen. None of that positive stuff happened. What are you talking about? All or nothing thinking. So that idea of like, I'm never going to be able to work again. It's very, very black and white. It's either this or it's that, and it's nowhere in between. Catastrophizing. So that's only seeing the worst possible outcome in a situation, kind of similar to disqualifying the positive, but on a much like grander scale. So for this type of therapy, we use a thing called cognitive behavioral therapy, CBT. You guys have heard me talk about that before. So this is based on that idea that when an event happens, it impacts your thoughts, which influence your emotions, or potentially the other way around. We're not really sure what order it goes in. That's the way I like to think about it. And then your emotions influence how you're going to respond, what reaction you're going to have. So this is sometimes what causes psychosomatic disorders in people.
So when we did this episode, I think it was the mindfulness. I think it actually might have been the anxiety episode. There was a acronym that I found on called RAIN. And actually I took a continuing education course, which I have to do to keep my physical therapy assistant license up to date. And it was on mindfulness. The episode was on mindfulness. So it was the class was on mindfulness. It was really, really cool. But one of the things that really stuck out to me was this acronym, which has a lot to do with cognitive behavioral therapy. So RAIN, it's kind of talking about your cognitive distortions. So some of those bad thoughts that we have, which all of us do have them, it's just human nature. But RAIN, R means to recognize the feeling. So recognize that you're having this feeling. Let's say you're in physical, maybe, what example did we use exactly? You said we're in physical therapy and you're feeling, what's the word? It's on the tip of my tongue. Discouraged. You're feeling discouraged, guys. So you're feeling discouraged about your progress. You're feeling discouraged about the injury that you have. You're going to recognize that you're feeling discouraged. A is you're going to allow the feeling. Allow yourself to feel discouraged because you're feeling it, so it's valid, you know? I is to investigate with kindness. So why am I feeling this way? Why am I feeling so discouraged? And then N is to non-identify with the feeling, because you are Sammy, I am Gabby.
Right.
Zen is Zen. Sean is Sean. We don't have to identify with our feelings and our thoughts. So that's RAIN, the acronym. I like to use it. It's kind of nice to think about that. If you're ever in a situation where you're having negative thoughts, think about RAIN.
Yes. RAIN being in a positive sense.
In a positive way. So if you guys are just tuning in, this is In It Together with Gabby and Sammy. I'm Gabby. This is Sammy J. She's a mental health therapist. I am a physical therapy assistant. And together we do the show where we talk about coping with emotional, social, and psychological well-being to promote self-healing and self-development. And today we are doing our 4th episode in the series we like to call Holistic Approaches to Healing the Mind. Right now we are covering physical therapy and how that can be beneficial to your mental health. Rather you're in physical therapy or you're in therapy.
Either way.
Both ways around. So it's really cool. We've covered so far what physical therapy is, what it means to be a physical therapy or a therapist assistant in a mental health world. We talked about our stats and facts section. We talked about a really cool study where the Netherlands literally created a whole realm of a field called psychomatic physical therapy, which is really, really cool. And now we're just going to review a little bit of what exercise can do for our mental health. We did cover exercise quite a few episodes ago now, but in case you missed it or in case it's been a while, we'll cover it for you. So we're going to talk about exercise and mental health, but we're specifically going to talk about 2 really common ones, anxiety and depression. So exercise for anxiety. If you guys have ever experienced an anxiety attack, I hope that you haven't, but I have, and I'm sure somebody else in this chat has probably experienced an anxiety attack, but it feels really rough. your heart's racing, you're sweating, you're breathing real heavy. That actually is really similar or maybe even the same as your fight, flight, or freeze response. There's a new
There you
F in
go.
there. There's a freeze response, like a deer in headlights, fight, flight, or freeze. So, because we feel those types of things in general when there's danger, it can be affiliated with negative stuff. So, whenever you exercise, what happens? Heart's beating, you're sweating, you're breathing heavier, your blood pressure spikes up, all the same stuff. But you might not really enjoy exercising because it kind of feels like you're having a panic attack, right? Um, yeah. So the thing that you need to do to kind of desensitize yourself to those feelings is to exercise. It can really help you cope with those feelings and say, okay, I'm feeling my heart rate racing, I'm breathing really heavy, I'm sweating because I'm exercising, which is positive. So you're trying to affiliate those feelings that you might normally have with a panic attack with exercising, which is a positive thing. Because of course we know exercising can do a lot of great stuff for us, which Sammy's going to talk about, so I don't give it all away.
Yes, yes. So yeah, completing a workout can give you feelings of accomplishment, improve your self-esteem and your positive self-beliefs, decrease your self-perceived worries, and improve your social relationships, right? A lot of people like to have a workout buddy or do workout classes and that kind of stuff. So that gives them some social connection. Exercise has been found to be comparable to antidepressants and psychotherapy. So for certain people that maybe have mild forms of mental health disorders, maybe even to the moderate extent, they have found that they could potentially replace meds or therapy with exercise. Now, granted, hopefully they're doing that under the care of a therapist and kind of navigating that and not just going cold turkey from things. So we're not saying don't do that. But exercise really can do a lot there. Exercise can also reduce fatigue and improve the quality of your sleep. So, and a lot of that is due to the chemicals that are released in our brain. And that's why what Gabby was saying about anxiety, you have this scary kind of feeling and your brain starts to associate that with like we said, something positive being exercise because we're losing weight, we're feeling good, we're doing all these things, but also these chemicals going on in our brain are making us feel good. So your body kind of starts getting addicted to that feel good feeling that's going on in your brain too. So that's helpful.
Absolutely. And I'd also like to mention to you guys really quickly, if you want to feel really good after your workouts, we didn't even put this in our show, but I just kind of remembered it. If you work out way past your respiratory threshold, which is being able to like talk when you're exercising. Like when you're exercising, you shouldn't be so out of breath that you can't speak a sentence. If you go over that respiratory threshold, the feel good effects of your exercise are delayed by several hours. I think 3.
Yeah,
I
that sounds right.
Don't quote me on that. Go back to the
I'm pretty sure it was 3.
double check, but I believe it's 3 hours. So
yeah.
Instead of feeling like, man, that's a good workout, I feel so good and accomplished, you're gonna feel like crap if you do that. So don't overdo it. You don't need to be Superman here. You're trying to feel good, right? That's the point. Absolutely. So guys, if you're just tuning in, this is In It Together with Gabby and Sammy. I'm Gabby. This is Sammy J, mental health therapist. And we do this show every single Tuesday at 9 p.m. Eastern Standard Time. We talk about coping with emotional, social, and psychological well-being to promote self-healing and self-development. Today, we're talking about physical therapy and how it's beneficial to your mental health, especially when you use it in addition to your mental health therapy. So it's pretty cool. Make sure if you guys want to come back for future episodes that you hit the star up here by my name. And please also favorite Sammy J because she's a lot of the brains for our show. Really, this one I knew a lot.
This one you got this one.
Because I knew a lot of this stuff, which is great. But guys, I do acknowledge that you guys have a lot of questions I'm seeing in the comments. We will have a Q&A with Sammy and also with our guest who will be in the box very shortly named Raina. She actually went to school with me. She's a physical therapy assistant. If questions kind of go off base, we might not answer them tonight, but we do have an Instagram. Me and Sammy have an Instagram. So if you press her bio, our show's Instagram is in there. So make sure you press Sammy's bio, follow us on Instagram, and if you have any questions, message us. But don't just say hi. Say, hi, I have a question about mental health, or this is my question, or what, I have a suggestion for the show. So make sure you message with the purpose. Don't just say hello because we'll probably not respond. But we are definitely looking forward to all of your questions, even if they don't necessarily relate to physical therapy and exercise. We might not get to it in this show, but please send us a message on Instagram. Sammy, is there anything you would like to add before we have Raina get in the box? And we actually are a little later than I was expecting.
Yeah, I don't think I have anything else to add. I'm excited to see Raina and hear everything she has to say. So I'm gonna jump out of here, guys, and I will see you guys in a little while.
All right, Sammy, thank you. Raina, it is your time to shine, girl. Press that plus button on the bottom and press guest, and then you'll be able to be in the box with me. So, guys, if you're just tuning in, we're talking about physical therapy today. And so far, we've covered what physical therapy is. If you guys haven't been in physical therapy before, this might be some new stuff for you. We've covered what physical therapy is in mental health, our role in that. So physical therapists and assistants need to be educated, so they would need to specialize in that kind of a stuff and kind of thing, or they would just need to be lucky enough to get that experience. Right now, we're just waiting for Raina to get in the box. Raina, are you here? Oh, I think she's here, guys. So Raina is a good friend of mine. She's a physical therapy assistant, just like me.
Guys,
Raina, thank you so much for joining us. I apologize that it's a little later than I was expecting. I thought we'd be a little bit ahead of 15 minutes at least.
that's okay. No worries. My early patients are actually at 9, so no worries.
Awesome. Well, thank you so much for being here, Raina. So actually, no one here knows who you are because you're not even from this app. So if you don't mind
No.
telling us a little bit about yourself, that would be great.
So I'm Raina. As Gabby has introduced, I am a physical therapist assistant. I've been doing this for just shy of 3 years. I've kind of done every kind of setting except for peds and home health. But I have done nursing home. I have worked in the hospital in the height of COVID, and I'm currently transitioning into outpatients, the wonderful outpatient world now.
That's awesome. I'm really excited for you. Raina actually just started a new position on Monday, so congratulations to you. That's so amazing.
Thank you. Thank you.
So Raina, why did you decide to go into physical therapy?
So through high school, I always knew that I wanted to do something in the medical field. But at that point in time, I didn't want to be a nurse or a doctor or anything like that because I can't deal with other people's bodily fluids. So I said, nothing crazy. And then I was actually in PT, and my physical therapist was like, well, why don't you come and shadow me for a few days? And I shadowed him, and I fell in love with it. Like, being able to be hands-on with a variety of people and being able to help them is so rewarding.
Absolutely. So that kind of goes into a nice question. So you've been in physical therapy, you've been a patient, which is really cool. I'm going to
Yes.
ask one more time, if you guys have been in physical therapy as a patient, can you hit a 1? I'm just curious who's still here, who can relate to this. And if you can't relate, hopefully you'll be able to learn something from our conversation here. So Raina, why were you in physical therapy?
So I was in physical therapy, I guess 2 times. Once for my ACL. I had a severely stretched ACL, and I did about 8 or 9 weeks of preoperative therapy. And it wasn't getting any better, so I had to have surgery. And then I was in therapy for probably another 6 or 8 months, rehabbing my ACL. And I returned to basketball, which is how I got the injury. Shocker. So I returned to basketball that following year, and I injured my ankle on my other leg, and I was in one of those big bulky walking boots for 8 weeks. I couldn't put any weight on my foot. I had a deep bone bruise in the weight-bearing bone in your foot called your talus. So I wasn't allowed to walk. So then I was in PT for that, and I actually had to learn how to walk again because I went so long. So they were that was the majority of my rehab, was teaching me how to walk.
That's like That's like a really big shock to go from being an athlete to going to not being able to walk. That's really insane. So thanks
Yeah.
again for being here. If you don't mind getting a little vulnerable, how did you feel in those moments where you were like not able to be super independent at those before the physical therapy worked?
It was disheartening. I mean, I was 15 and 16 at the times of these injuries, so that's a very vulnerable age to begin with. And the only place that I felt like I belonged was in sports. So I was down. It was a lot, and it was a lot to take in. I had to sleep downstairs for weeks because I couldn't even like scoot up my steps. So you hit a dark place. But the therapy finally started, like, I started seeing improvements, and my physical therapist was like, you can start to go, you still using your crutches at home, but you can start to put your foot down. And then it got to, well, you can use one crutch at home, and then kind of no crutches at home. I still had to use my crutches when I was out in public because people would just run me over, run into me, and I didn't really need that.
Yeah.
So it was, I struggled a lot, and I had a great physical therapist and an assistant as well, a physical therapist assistant, and they helped me to kind of work through everything. They were very much like, let's take it day by day. We'll just keep moving forward because this isn't something that we can rush, and slow progress is still progress.
Would you say that you're a patient person or are you an impatient person? I'm just curious.
I am an impatient person. I can't wait for anything.
Well, this was probably even worse for you because you do have to kind of take it easy, take it slow, so you don't hurt yourself even more.
Yes. I have learned a lot of patience from that, but yeah, it's a lot to take in.
Yeah, for sure. So, so how did going to physical therapy and having the therapist and the assistants there for your journey to getting back your independence, getting back to sport, impact your mental health?
They definitely had a very positive impact. They never let me dwell on the fact that, okay, I could only do half of an exercise, like half of a full movement of an exercise. Like, they never let me dwell on it. They always tried to dwell on the positive. They were very much like, well, so when I had my knee surgery, I had a lot of quadriceps weakening. So my quad muscle was not very strong. So I had a really hard time getting my legs straight. So we focused a lot on strengthening that muscle, but we also took into the consideration that I had been in a brace for, oh gosh, how long at that point? 4 months at that point. So my quad muscle wasn't able to work by itself to gain musculature.
Yeah.
So they helped me to focus, like, the little things. So we grade your strength on a almost like a numerical scale, and they would say, well, you've improved from a 3+ to a 4-, that, which is better. So they would always use those objective measures to kind of talk me up and keep me going.
Yeah, absolutely. And Sammy and I kind of mentioned, like, when you go in the physical therapy, so what we do is we measure your strength, we measure the range of motion you have, and that's kind of your baseline. That's where you're at when you come in. And then, but we're supposed to improve those scores as we go on through therapy. So you always meet up with a therapist later on to kind of see where you're at. And it might be hard to see your progress, especially when you're living with the pain of, in your case, you said you had an ACL and in your ankle too. That's a lot. Both sides too.
Yeah.
Wow.
Yes.
So
Yes.
yeah,
Less, and the injuries were less than a year apart.
oh man, that's a bummer. I'm sorry you went through that. But, but honestly, and I also just I noticed that Destiny said she really didn't find a therapist who really cared. I'm really sorry to hear that, because your therapist plays more than they in a role in your mental health than you think. You know what I mean? Because like sure, like you come to therapy and we're gonna prescribe you exercises and things like that, but we're also supposed to be your cheerleaders. That's
Yes.
part of our job. That's part of what we're supposed to do. We're supposed to make sure that you're being positive, make sure that you're not like kind of like Raina said, you're not dwelling on that stuff, because it's very easy to see the negative parts of an injury. So yeah, I am so sorry Destiny went through that. So actually I kind of gonna build off of that, Raina. What would you say is a good way to find a good therapist if you're maybe in this situation where you need to find a physical therapist?
Definitely look at reviews of the clinic that you're going to. But you can kind of tell a lot about a clinic based on how the front office staff is going to treat you. If they are happy and welcoming, that typically means that there's an upbeat vibe in that clinic. The clinic that I'm currently working at, I mean, you can't see a smile on our face right now because of masks, but I mean, we always try to keep a good and positive vibe going in our clinic. I mean, it is owned, like it's a big corporate clinic, but we're local therapists. Like we're not big city buyouts or whatever, but we're yeah. So, but you have to find somebody who, I mean, I'm a person that I get along with everybody. Truly, I am a very bubbly person. So I try to adapt my my attitudes to my patients, because some patients don't want my bubbly attitude. They want somebody who's straight-faced and serious. So sometimes I have to be like that with them.
Yeah.
But other times I really try to keep that positive vibe with them.
Absolutely. And so knowing the kind of physical therapy assistant you are, could you tell me a little bit about like someone you've worked with who you've seen maybe come into therapy not so positive about where they're going, and seeing how they've progressed not only physically but mentally? Tell me a little bit about that kind of an experience you've had.
So the biggest experience that I've had with that, when I was actually working in Texas, doing travel work, I was in a skilled nursing facility, and I was treating this woman's husband originally. And then when we did like our quarterly screens, we picked her up on our caseload, and she's like, "Sweetheart, you're never going to get me to walk again. I'm never going to stand again. So you're wasting your time." And I said, "I'm going to give it a try though. And if you're going to try, if you're willing to try, I'm going to try to get you there. We might not walk, but we're going to try to stand, and I'm going to help you stand. We're going to get you into a wheelchair without using a mechanical lift." So I worked with her for about 6 months, and we did a lot of strengthening, upper and lower body. We did a lot of like initiation of transfers, so getting like into the parallel bars and trying to stand up from her wheelchair. And about 6 months in, I was able to get her to stand up for 1 minute. She hadn't stood in 4 years. And let me tell you, this lady cried.
Aww.
I cried with her. I'm not even gonna lie. I was crying with her. So seeing her go from, "No, I'm never gonna do this. My body just won't do it anymore," to, "Oh my gosh, I can actually do this." It is so rewarding, and it makes every bad day, difficult patient worth it.
Absolutely, absolutely, and that goes to show the kind of therapist you have definitely makes a difference. If you have a therapist who's able to try to curb that negative mindset that you have, your mindset's huge. It's huge in life in general, but definitely in like physical therapy. So if you guys have ever had an injury, you've ever been in an accident of any sort, maybe if we're born with a disability, having a positive mindset can really take you like the extra mile for sure.
Yeah, I completely agree with that.
Well, Raina, we're kind of getting near the end of our time here. Is there anything else that you would like to add? A lot of people here have never even had physical therapy, so I really hope that you guys have gotten something out of the whole show, out of this conversation. Raina's an amazing person. I don't know if you'll ever go live on here, but if you do, guys, make sure you favorite Raina, because if she ever goes live, it would be really, really awesome to see you guys there. I'll be there.
I know you'd be there. I'm only gonna add one quick thing. We've talked a lot about people who have, like, it's the only people who have come to therapy, they've had injuries or surgeries, or they have some sort of neuromuscular disorder. Therapy is more than just that. You can come to PT just for conditioning and general strengthening. You don't have to have an injury before you can get physical therapy, because there's direct access clinics. So you, like I said, you don't have to have an injury. It's really for anybody.
I'm glad you said that. That's a really good point. So guys, if you have any questions for Raina, by the way, if you're just joining, this is In It Together with Gabby and Sammy. I'm Gabby. Sammy is in the chat. This is Raina. We're actually both licensed physical therapy assistants. We went to school together, so it's super cool to have Raina on. I've been out of work for a while, as a lot of you know. So Raina has actually been getting all of those experiences this past 3 years or so. So I'm really glad to have you on. If you have any questions, please put them in the chat, and Raina can answer them for you if you have any questions. Thank you guys for hitting the hearts. Thank you for being here in the chat. Thank you for being so patient with us, because I know we don't get to your questions right away. Yeah, you guys are awesome. So I hope you got something out of this conversation.
Oh, you're welcome, Sammy.
Yeah, if you guys have any questions, this would be the time to ask. If you have any questions for Raina. If you have any more mental health questions, that would be for Sammy when she comes back in the box. Dun, 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 dun. BK has a question. BK, put it in the chat, my friend. We would be happy to answer it for you. Raina, thank you again for being here. I really appreciate it.
You are so welcome. Thank you for having me on.
Absolutely. Raina is not from Meet Me. I actually introduced her to Meet Me, so it's really cool to have her on. BK, why are people so judgmental when it comes to people's voices being different? Unfortunately, we can't answer that one. But if you have any questions about physical therapy, we can answer that for you. Wondering what you suggest for herniated discs when you become stuck in place while you're lying down or sitting.
The best advice I can give is just try to maintain stretching. Find a position, whether it's like bending forward or like kind of like you're doing a back bend, and see which position gives you the most relief, and just do stretches in that position to help you out.
If anyone has any other questions for Raina, Raina's here with us. She's a physical therapy assistant. And today we're talking about physical therapy and its impact on our mental health. So thank you guys for being here. Destiny, I'm glad we could answer your question for you. Any suggestions for helping through PT someone who has ALS?
Honestly, just taking it one day at a time, focusing on one goal. Like pick a goal, and that's the one that you want to work on that day. That's instead of trying to look at, okay, I have these 12 goals that my therapist wants me to reach. No, today let's focus on this one. That would be my advice.
How important is PT when doing a nerve block?
Nerve blocks are a tricky subject, and it depends on your physician whether they want physical therapy soon after a nerve block, simply because the nerve block in conjunction with PT can have a negative effect. So that's usually physician dependent.
BK, I think that's a good question for Sammy. So when Sammy gets back in the box, we'll answer that one for you. Deo, you're amazing. Thank you. That's very, I like that. Stop staring at the mountain. Focus on the step in front of you. This time is temporary. Be patient with yourself. Great advice. Thank you, Deo. Reina is smart. She is smart. That's why she's a licensed physical therapy assistant, guys. She is very educated. How can I stop being negative? Let's you know what, guys? If you don't have any other questions regarding physical therapy, make sure you favorite Reina. She's not from the app, but she is here now. So if she decides to go live someday, then you'll have her favorited. So you guys can join her streams, ask her any questions you have. Reina, is there anything else that you would like to add before you go?
No, I don't think so.
All right, Reina, thank you so much again for being our guest. I seriously appreciate it. I know that you're like a super busy person, so it's just amazing that you to come on here. So thank you so much, Reina.
Thank you for having me on. You guys have a great night.
Absolutely. Bye. All right, guys, if you're just tuning in, this is In It Together with Gabby and Sammy. We just spoke with Reina, physical therapist assistant, about her experiences as a patient and as a therapist. And it was really cool to hear what she had to say. So Sammy J, welcome back to the welcome back to the show, girl.
Thank you. I missed you guys. Yes, Reina killed that. That was awesome. Again, thank you so much, Reina. It was so good to see you, get to hear you.
I knew you would love her. She is so amazing.
I do.
Unfortunately, you didn't get to have an actual meeting with her like we normally do with our guests because of Easter Sunday, but she's amazing, and I'm so glad that she agreed to be on the show.
Yes. So who's got more questions?
If you have any questions regarding mental health that are kind of related to the topic today, we will answer them for you. If your questions are kind of like far off.
Yes, BK. So you were talking about de-stressing.
Yeah, he wanted to know how to de-stress, BK.
So de-stressing. So we were talking about, I don't know, BK, at what point you came into this conversation. We were talking about how stress can cause problems with our physical well-being and how that can cause people to need physical therapy. So de-stressing is a really important thing. So it's good that you brought that up. So that really looks different for different people though. So everybody has different ways to de-stress. And we just want to make sure whatever strategy we're using, it is healthy for us. So it's nothing that's going to harm ourselves, harm our bodies, harm other people, those kinds of things. But literally anything can help with de-stress. Yeah, singing, playing instruments, all those things really, really helpful. Yeah, so that, I mean, that's a really broad question.
Yeah, I guess it just kind of depends on who you are as a person and where you're at in life and what you enjoy. Because some things might help other people and they might not help you. So,
well, and some things you might want to like try. Like you might look at it and be like, oh my gosh, I'll never do that. Like I think a lot of people feel that way when I throw yoga at them. But then we talked to Artemis about how great yoga is and how beneficial it can be to our mental health. So sometimes we have to like take a dive and try some new things if we're finding ourselves to be really, really stressed and our normal coping skills aren't working.
Yeah, BK, I recommend checking out Artemis's show tomorrow, Breath by Breath. It's at 1 p.m. Eastern Standard Time. She teaches yoga and breath work, and I think right now she might be going over the chakras. So it's a really cool show, and honestly, do it with her. Really, if you have a mat, get a mat, do the yoga with her. Seriously, that's why she does it. She does it so that we can do it here at home, and it's super beneficial. But if it doesn't work out for you, maybe that's not the route you want to take, but I recommend trying it.
And I always tell people, try everything at least 3 times, unless it's like causing you physical harm. Try it at least 3 times because, you know, the first time you try it, you might not work because of anxiety, or maybe it was just like the wrong moment for that. But like try things multiple times before you give up on it. Again, as long as it's not causing you physical harm or mental harm.
Is working out when bad a good thing? I'm not sure what you mean exactly by that. When you say bad, are you talking like physically, like you're bad, like injured, or do you mean like mentally you're not in a good place? I don't, that question's kind of, maybe rephrase your question so we can answer it for you, because I want to give you the right answer.
Yeah, I was a little confused by that one too.
Guys, thank you so much for being here tonight. If you've been here since the beginning, can somebody hit a 1? Everybody hit a 1 if you've been here since the beginning of the show. Sean, Chelsea, Cody, Cheyenne, Karma, Kennedy, welcome to the show. I'm glad to see some new faces. If this is your first time here, hit it 2. I just want to see who the new faces are.
Chris is not.
Thank you guys so much for being here. You guys are amazing. we've covered physical therapy and its benefits on our mental health today. So I'm really, really hoping that you guys have learned something. If you guys have gotten something out of the episode, let me know in the chat. Have you gotten something out of the episode? Is there something you learned? If you have any questions that maybe we didn't cover, this is probably the last chance you're going to have to ask in the chat.
Yeah, questions, things that you found interesting.
Relearning how to do the simplest things are sometimes not explained very well. Would you mind? Well, that's a really broad question, Deo.
I think there's more coming.
Oh, there's more coming. Elaborate as you do as a PT to help such. So Deo, I'm a physical therapy assistant, and so is Raina, who was our guest. So pretty much you see a physician of some sort, they diagnose you, they have goals for you to reach, and then they prescribe you physical therapy. The physical therapist then will evaluate you and kind of reiterate those goals, and then they come to us, the assistants, and they say, okay, I want them to they kind of start, we have short-term goals and long-term goals. So maybe the goal is to have you walk 10 feet. Just an example. Maybe you can't walk 10 feet, but that's our goal, is to get you to walk 10 feet. So what we do is we prescribe exercises. We prescribe neuromuscular reeducation, where we kind of reteach your nerves to fire appropriately. Because, I thought, what did you say was a stroke?
Yeah.
So I've worked with people who have had strokes in their past. So I've never worked with somebody who came to me for a stroke. But also I have been out of work for some time. That would have been a really great question for Raina. But yeah. So as you achieve goals, we talk with the physical therapist and say, okay, we document and say they've reached their goals, or maybe they're having trouble reaching that goal. Is there maybe something we can do to help them get there that we haven't already tried? So, there's a lot of things we can do for people, in general, that help for most people, but sometimes individuals will need us to think outside of the box.
And I will say, in my experience with my physical therapist, that evaluation process was a lot of questioning, what do you want out of physical therapy? Where do you want to be? It's not just the doctors or the physical therapists setting the goals for you. They may, I think, help kind of guide what is realistic and what is maybe not so realistic. But there's usually a lot of asking for input on where do you want to see yourself? And then they kind of help you figure out how to get there.
Exactly. And a really cool thing, Deo, about strokes. When I was in school, I actually did a research presentation on something called mirror therapy. So generally a stroke will affect one side. So one side will function and the other side will not. So what they do is they put you in front of a mirror so that you see your left arm doing the motions while you're trying to move your right arm to do the same thing. So it appears that your right arm is moving, and that actually can kind of do something in the brain, like that light bulb goes off, and all of a sudden you start to have that motion. Mm-hmm. So that's something really cool that I learned. I don't actually know how often that's used, but I
think that's also used too with phantom limb pain and stuff, isn't it? When you have a missing limb and there's pain that's not there. That's that psychosomatic stuff we were talking about, right?
I haven't read any research on that specifically, but that phantom limb pain is definitely really wild.
I remember learning about that in school. That was a technique that they would use to kind of see the limb there, kind of help with that process. I can't remember exactly how it worked, but yeah.
See Raina right here, guys. Raina was just our guest. If you missed her, she's a physical therapist assistant. We actually went to school together, which is really cool. So we're both PTAs, but she has had a lot of experience, more so than me, because I actually have an injury that's kept me out of work for a while. So if you guys have any more physical therapy questions, Raina right here, you guys can hit her with a favorite and potentially maybe send her a message. But if you can't send her a message our Instagram in Sammy's bio, in it together _meet me, and I'll relay the message to her, or I'll try to answer it if it's something that's I'm able to answer, because I am a physical therapy assistant as well. Sammy, is there anything else you would like to add? This is probably going to be the last call for questions if you guys have any.
No, I think this was a really awesome show. It seems like people are learning a lot, and I love to see you guys learn things. Makes me get all happy on the inside.
If you guys learned something today, hit a 1. If you got something out of this episode, hit a 1. 01111111. Guys, thank you so much for being here tonight. I appreciate you. If you want to come back next week, we're going to talk about the benefits of something really cool that I would never expect to cover. We're going to talk about boxing, guys, with Zeke Illinois. I hope I'm saying her name right. We're going to talk to her, and then I'm going to make sure I say it right next week. But there's actually a lot of research on boxing and how it can benefit our mental health, guys. So we're going to talk about that next week. Zeke Illinois, who is the host of, oh man, let me get the show right. Somebody tell me what
I can't even remember what it's called. It's about boxing.
Total Knockout. She is she's a boxing instructor. She has a show on here. I am so sorry that I didn't get the date and time of her show, but if any of you guys know it, please put it in the chat. I believe it's Mondays, but I can't remember the time. So guys, she's gonna be our guest next week. It's gonna be a really, really cool episode.
She'll tell us all about it.
It's gonna be a really cool episode. If you guys ever have any ideas that you would like us to cover, please message the Instagram in Sammy's bio. Yeah, please, and don't just say hi. Say,
No.
hi, I have a suggestion for your show, or hi, I would like to be a guest on your show. Make sure that you're very specific with your question, because hi will probably not get a response from us. So we appreciate the highs, but the show's Instagram is for the show, not for chit chat. But I do appreciate you guys for it. So make sure if you want to chit chat, you favorite me so you can come hang out in my live every day. And also please favorite Sammy J. Once again, she's not a physical therapist.
I'm not a physical
She's
therapist.
a mental health therapist, guys. So if you ever have any questions on mental health, she's your girl. She goes live mornings, usually around 8 a.m. Eastern Standard Time for about an hour, and then you'll see her kind of throughout the day.
I like to sprinkle myself throughout the day here and there when I can.
So guys, thank you so much. We're gonna end the show with a tarot card like we do every week. So this tarot card, which will be posted along with all of our resources if you guys would ever like to kind of see where we're getting our information from. The card says, what is my body telling me right now?
What is it telling me right now?
My back hurts a little bit.
Go to bed. Go to bed.
Our body speaks to us through physical pain or discomfort. Our body sends messages for us to look more deeply. See the trapped emotions, the lurking fears and beliefs that limit you. Listen to your physical body, and you will be led to the source of your pain. It's time to get your healing on.
Ooh,
And there you have it, guys.
get your
That's
healing
it.
on. Let's go.
Thank you guys for joining us. Make sure you hit the star on me before you leave so you can join us next week to talk about the benefits of boxing. And please favorite Sammy J so you can come hang out with her and her streams and ask her any questions you have about mental health.
Absolutely. All right, I'm getting out of this box now. You all have a good night, and I'll see you guys next week if I don't see you in my stream.
Goodbye, Sammy J. Guys, thank you so much for being here. I seriously appreciate it. Once again, if you have any suggestions for the show, or if you'd like to be a guest, please message us on Instagram. My personal Instagram is in my bio. It's just a button. But the show's Instagram, which is where you would actually need to message me, is in the bio of that Instagram. It's like it's like a treasure hunt. Or you could just type it in it together _meet me. Or just press Sammy's name and you can get it there as well. Guys, thank you so much for everything you do. I love and appreciate you guys, and I'll see you tomorrow morning for our regular stream. I might have some fun stuff in store, so I can't wait to see.